Okay. Good morning, everyone. Thank you so much for joining us today as we present the findings from our COVID-19 parent survey, investigating how the COVID-19 pandemic has impacted California parents' childcare arrangements, plans, and preferences. I'm Gemma DiMatteo, the Research Director at the California Child Care Resource and Referral Network.
And I'm Kiyesha Nzewe, I'm the Director of Public Policy.
So our agenda today, I'll go over the main findings from the survey. We'll have Kiyesha go over the policy recommendations based on the findings, and then we'll have time at the end for any questions that arise throughout the webinar. So this webinar is being recorded and it'll be shared on our website shortly after. Since we do have a large group, everybody is muted, but we have a Q&A box. You can type in any questions that you have. We have somebody monitoring that, and we'll have time at the end to read out and answer as many questions as we can. There's a link that is in the chat box, or will be posted in the chat box, and you can follow that link to download the report and also download these slides. So our survey was distributed from the end of June through the end of July 2020. And it was distributed through our local R&Rs in California, our resource and referral agencies, and also through various online platforms from us. We had almost 13,000 people at least start the survey. Some were disqualified, but we had over 9,000 complete every question of the survey, which was a really great response rate. We offered the survey in both English and Spanish, and we had about 5% respond in Spanish. So we had a good distribution across the state. We had at least one person complete the entire survey in every county, except for 3 counties. So we had 55 out of the 58 counties represented. And you can see some of the counties with the largest response rates were LA, Orange, Sacramento, Napa, San Diego, San Bernardino, and San Joaquin County. So the distribution of income was definitely skewed more toward lower income families. There weren't so many in the mid-range. The California median household income is about 80,000. So those were fairly low, but we did have some in the higher range as well. The majority of respondents had preschool or school-age children. Just 20% had children under 2. The majority of respondents were working outside of the home. And this was earlier in the summer, although there were also 32% working from home. And most respondents who were working full-time. So this question was asking about their current childcare arrangement when they took the survey. And again, this was late June to the end of July. And so 30%, that was the highest group, were using centers at the time. 26% were using a family, friend, or neighbor, and 21% using a family child care home. But a good portion, 22%, did not have any child care and were working. So were either watching their children at home themselves or having a partner or spouse watching them while they work. So this question was asking what they were planning to use in the fall or when school started. And you can see centers went up a bit and family, friend, or neighbor went down. FCC, family child care, is about the same. We have a high percentage of people who still weren't sure what their plan was, which makes sense given the timing of the survey, especially for those who filled it out earlier. There was a lot of uncertainty around schools, if they would be in person, and just general uncertainty about what was going on. But it seems like people were, during the summer, planning to continue to or they were sort of juggling and figuring things out, but planning to come back to maybe a more familiar setting come the fall. So interestingly, 57% said that their plan for the fall was not different than what they were planning on doing before the pandemic. This may be also because of the timing of the survey, that we don't know if these people actually did end up sticking to that plan. But this was also interesting that the ones who said that their plans had not changed tended to be lower income. And then the ones who said the plan had changed were tended to be higher income. And this could be because the higher income were planning on using centers before. And for the lower income, maybe they were planning on using family, friend, and neighbor, more informal care before the pandemic and also after. So this was an open-ended question. We asked them, for those who said that their plan had changed, we asked them how it had changed. And we went through and coded the themes from their responses. So the majority, almost 50%, mentioned that they were relying on school or before and after school programs as their childcare. So these are people with school-age children. And then they were left to figure out childcare for the first time in a while. The second most common theme was that their childcare program had closed or restricted their enrollment or their hours. And then the third most common response was that not that there was an external factor preventing them from finding care or forcing them to find care now, but that they just weren't comfortable with their child in a group setting, and so now wanted to keep them home or with family. Some of the other responses that came out, parents who lost their jobs so didn't need care now, people who are currently working from home, parents who left their job, cut hours, or delayed looking for work because now they had children at home to watch, and it was hard to find childcare. There were people who had a family, friend, or neighbor provider originally, but now because of social distancing or because that person is high risk or lives with someone high risk, they can't use them anymore. Some people mentioned their work schedule changing. They had a nanny or babysitter who's now not available because of the pandemic. Families, these were higher income families who mentioned delaying kindergarten with another year of private preschool or transferring their child from a public kindergarten that they were planning on going to a private kindergarten program. Families who changed their childcare to a smaller group setting, a parent who started to work to cover lost income from another parent, and then the parents staggering their shifts at work so that they could cover care. So this question, we asked people if they could choose any type of care for the fall, what would they be most comfortable with? And 34% said centers, 24% family, friend, and neighbor, and 21% family childcare. And we'll talk about this in a bit, but this is similar to the arrangements that people already had. So we asked people to rank these factors in order of most importance to them in choosing childcare right now. And the one that came to the top was cleanliness and sanitation, followed by smaller group size and cost. And when we disaggregated this data based on all types of factors, income, language, region, setting preference, this was the same across the board, and cleanliness and sanitation was number one for every single group. So in this question, we intentionally forced people to choose between licensed family child care home or a licensed center, and gave them the option of saying they weren't comfortable with either. And you can see it was about a third of each fell into each category. But the 1/3 not being comfortable with either is pretty significant, and this clearly affects the demand. So even if we shore up the supply of licensed care, there's this group of families that would not be comfortable with any of it. So when we looked at people's plans and preferences based on their current childcare arrangement, it pretty strongly correlated with what they already had. So people who were in centers plan to use a center and preferred a center. This is the same with family childcare, family friend and neighbor, babysitters and nannies. The only difference was with people in a co-op, they preferred family friend and neighbor and center. So with this question, we wanted to look at sort of a neutral or unbiased group to see what their preferences were. So for those who didn't have childcare and were working, or those who didn't need childcare because they weren't working for whatever reason, their preference was family, friend, and neighbor, and then center, and then community after school program, and then family childcare. So here we looked at differences based on the age of the child. And with the infants and preschoolers, it matched the state pattern. But those with at least one school-age child, you can see there's a much higher preference for family, friend, or neighbor care, followed by center and then family child care. So we looked at, this is actually looking at the free response answers. I noticed that a lot of the responses in Spanish mentioned losing their jobs. So we went back and looked at the question where we asked about their current work arrangement, and compared those who filled out the survey in Spanish versus those who filled it out in English. And for those who filled out the survey in Spanish, 43% had lost their job or been furloughed. And for those who filled it out in English, it was only 15%. And this is not necessarily representative of race or ethnicity. This is just the language that they chose to fill out the survey in. And so this is the preferences for those who filled the survey out in Spanish. You can see this is pretty different from the aggregate pattern. So there's a much higher preference for family childcare. And this was the third preference for most of the other groups. And then that's followed by family, friend, or neighbor, and then center. And this wasn't necessarily surprising to us at all, but is important to consider during the pandemic, since COVID-19 seems to be having the harshest impact on the Latinx community, and many are likely essential workers. It's important to know where to target supports and efforts to limit the spread. So here we compared the plans and preferences for settings for those families making under $100,000 a year and those making over $100,000. We broke these up into smaller groups, but these were the groups where we saw the biggest difference. So you can see that for those in the higher income group, there's a very strong preference for centers. And those in the lower income group, center is still number one, but the home-based care is much higher. And this could be because centers, their schedules tend to fit the schedules of work schedules of higher income workers, and also possibly the cost of centers being higher. So we looked at any differences that we found between 4 regions of the state. So the regions that we use at the network is the North, the Bay Area, the Central Valley, and the South. There's more detail on which counties go into which region in the report. The South showed the same pattern as the state because probably because there were a lot of responses from the South. But when we looked at the North, we saw a slight preference for family childcare here, and less people were uncomfortable with licensed care. In the Bay Area, we noticed that there was more family, friend, and neighbor use. It's almost tied with center as first. And a lot of people here don't have any childcare and are watching their children at home or have their partner watching them. With the Central Valley, we saw very high family friend and neighbor use. And a lot of people were not comfortable with any licensed setting, which makes sense given the high FFN use that we saw before. So we asked people to explain or describe why they preferred their preferred childcare setting. A lot of parents mentioned, just overall mentioned that they trust people that they're already comfortable with. For those who prefer centers, there was a lot of mention of them being comfortable because they follow guidelines, they have more regulations, this is perceived. They have bigger spaces, they don't trust other people's homes. That would be, yeah, comparing it to family childcare. Centers are controlling who comes on site, so a lot of centers don't allow the parents to enter now during the pandemic. They can help with homework, they have a curriculum, they're seen as more professional, and they have cameras. For those who preferred family childcare homes, they really liked the smaller group size, the communication that they have with the provider and the other parents. They like that they can enter the facility. Some parents mentioned being uncomfortable, not being able to go into centers now and see where their child is going. And a lot of trust with the provider, mentioning that they're like family and they have known them for years. For those who were most comfortable with family, friend, and neighbor care, they mentioned not being comfortable with any group setting. But if they need to use care, then they see family members as the safest option. Generally, they're not with other kids, or if they are, it's a small group and they're probably kids that they already know the families and trust the social distancing and measures that they're taking. And they trust the adult that they're social distancing and using all of the cleaning precautions. There was a lot of mention about worry around the vulnerability of this provider, the family, friend, or neighbor, if they might be older or higher risk or live with people who are older or higher risk, especially if these are parents who are having to go into work and be around the public and around people. And there was also concern for school-age children around this person's capacity to help with distance learning, specifically with technology and if they had limited English capability. So these are just some insights from the open-ended responses from parents. There was a lot of fear expressed of their child or people in their family contracting the virus. Some parents expressed uncertainty about being able to keep their childcare subsidy. They were worried if they didn't keep their kid in the program, either because they weren't comfortable sending them there or the program closed or for whatever reason, they were worried about losing that. And a lot of parents mentioned quitting their job, having to cut back on hours, or delaying looking for work because of childcare issues related to the pandemic. These are some quotes from the free responses from the parents. So I'll give you just a minute to read this one to yourself. And then this is another quote from open-ended question from the parents. So you can see there's a lot of anxiety and fear around what's going on right now and how they're going to survive. So One thing that became clear in looking at the quantitative data from the results and reading parents' responses is that there's no one child care setting or support that would help all families. And this is always the case, but especially now when you add varying levels of risk aversion to COVID, it becomes even more important. So based on various characteristics of the family, like their work, income, language, age of children, and just personal preference, one person's ideal situation might be another person's last choice. So as we saw, there are families who are most concerned about their school-age child's education and are looking for a center who can provide homework help, a curriculum, or they want social interaction for their social and emotional development. There are families who are terrified of risk of infection and want their children as close to home and safe as possible. There are those who prefer family, friend, and neighbor care for safety, family child care for familiarity and comfort, and centers for perceived professionalism. So it's really important to maintain a robust mixed delivery system because of all of these different types of families and their preferences. Another theme that emerged was how this pandemic will continue to widen the opportunity gaps for children and families. So we saw the inequity in the Spanish versus English responses in just unemployment now, to the difference in responses from the low and middle income families versus the high income families and what they're able to piece together right now. From the higher income families able to delay kindergarten or send to a private kindergarten or hire a nanny or a tutor, create these learning pods versus the lower and middle income families that seem to be really stuck, not knowing what to do right now. Yeah, it's clear that the long-term financial and learning impacts of this are not evenly distributed. So the last one, a lot of parents in the free response questions mentioned being frustrated that they were, especially with the school age children, being stuck in this position unexpectedly now where they're taking on the whole burden of having to find care when they were expecting to continue to use the public school system. And there were parents who specifically asked for public support throughout this time. Especially when a lot of them are making less money now than they were before. So focusing on ways that we can support parents throughout this time is also very important. So now we have the policy recommendations that Keisha will present to us.
Thank you, Gemma. So as Gemma just reviewed, we really must maintain a robust mixed delivery system. We have to support parents, and we really have to address widening inequality. So we have recommendations that cover all of those issues. So in helping to maintain center-based group settings, one of our first recommendations is that we make sure that there's private and public in-kind and financial assistance. And that may look like, for a lot of centers, their fixed costs have stayed the same. So they still have to pay the same rent, utilities, all of those things that don't change no matter how many children are in their care. But as we know, centers have had to reduce the number of children in their care if they've been able to remain open at all through this pandemic. And so our suggestion of public-private in-kind and financial assistance, it may include the free use of space, assistance in helping to reconfigure their space so that there can be proper social distancing, cleaning service so that it's adequately cleaned and sanitized each day, and even supplemental grants to help pay staffing costs as the staffing costs have increased drastically compared to the number of children that can be in their care. The next recommendation is that we think about, same slide, is that we think about switching up the ratios, because we know our best recommendations is that we keep our own interaction with as few people as possible. And by instead making it by family groups instead of each, like each group being different age groups, different children from different families, then that might help protect the health and safety of everyone involved. And so we suggest that we research those types of options. Next slide. Okay. For licensed family childcare, we offer that we develop a program that provides coaching for family childcare providers, and a list of all of the things that they should do to follow best practices in preventing the spread of COVID-19. And with that, we can develop a badging system so that parents know and can feel confident that the provider that they are researching or utilizing is doing everything possible to prevent the spread and to keep everyone safe. We also know that because of the CCDBG reauthorization, there's many new health and safety requirements, trainings that are required for providers that our state has yet to implement. And so we suggest that not to ignore health and safety, but because there are so many new health and safety requirements to remain safe in this COVID environment, that our state apply for a waiver to be able to delay the implementation of those additional training, health and safety trainings that are required on family childcare providers. Next slide. Okay. To make sure that licensed family childcare is visible for parents, because it is the type of care that is most available at this time, the type of licensed care that is most available. We feel like that there should be an allowance for license exempt caregiving in the parent's home. So right now, a family that has a voucher they are able to provide care within the home. However, due to labor laws, that family has to pay the provider minimum wage, and a voucher is not the value of minimum wage. But we feel like there should be an allowance for that, because many families, as data show, would prefer to keep their child with a family friend or neighbor. And because of overnight care or other reasons, they may feel more comfortable to do that care within the own child's home. We also know that home-based providers, as well as centers, but home-based providers need support in order to provide distance learning. So many children are in a home-based setting at this time, and not every provider has adequate technology or internet, or even the time as they're caring for both babies and a school-age child. And so they really need the support to be able to now become teacher and child care provider. So support for parents, many of us know that Congress is like kind of stuck, kind of not stuck. We don't know with CARES Act, additional COVID funding to states. And that's really, at the moment, probably our best hope, but we need to advocate for funds to support subsidized childcare for families. But one part that we could do on our own without federal intervention is to incentivize employers to provide childcare directly to their employees, or to subsidize the cost of childcare. This most often occurs with tax credits, and it could be done that way. Or employers could contract with specific childcare providers and pay them directly. But either way, we should incentivize employers to help their employees with their childcare. employers can also have greater flexibility in their workplaces. And so that might mean adjusting work hours, paying paid sick leave, and other family-friendly practices that will make it easier for their employees to both work and care for their children at the same time. So there are a lot of rules in our subsidy system that may cause disruptions. As Gemma mentioned earlier, there are families that are staying in care because they feared at the time that they would lose their childcare subsidy, so that it wouldn't be there once they decided to go back to work or go back to childcare. And as you can see in this recommendation, there's a lot of barriers in place that maybe don't need to be in place, that make it hard for parents to find care. And so at this moment, we think lengthening 12-month eligibility, which would mean that families would not need to recertify at 12 months, as that's coming up a lot, as we were 6 or 7 months into this pandemic, and so many families are facing that now. And it would also mean eliminating the family fee requirement. As Gemma noted, many families either have lost their job or have reduced hours, so they have reduced income. And then adding more flexible funding. So we know that there are geographic areas where there's a high density, especially the Central Valley, of very low wage workers. And so increasing funding for subsidy there and for providers. Next slide. So many R&Rs and APs, we could redeploy staff who are in regular contact with families and have them check in with parents to see how they're coping. At those agencies, they know the plethora of services that are available in the community, and they can offer resources to parents to help support them in other ways, whether it's with food, with housing, with all those things that we're worried about right now, childcare, when your income has decreased, healthcare, and these organizations can be a great resource to families. Another huge challenge that childcare providers are facing who are supporting distance learning is that they may have a child who is an English language learner, but they're receiving distance learning in English, and the provider may be forced to, if they are able, to translate, and again, taking attention away from the other children they're caring for. Or it could be that the provider doesn't speak English, and as they're listening to a lesson or helping a child with a lesson, may not be able to fully understand it because the lesson is in English for the child. So there should be support for non-English speaking providers and dual language learning children. Next slide. So there's widening inequality, as Gemma mentioned, that COVID has hit the Latinx community the greatest in California. And childcare funds must be targeted to shore up childcare supply to make it a safe option for families to use. And we have to support a range of resources for children and families. Again, it's not just childcare that folks are struggling with. It's food, it's housing, even transportation, having proper PPE in their workplace or in childcare, healthcare, it runs the gamut, and we need to make sure we're still keeping families whole during this time, especially those who have the least means. So we know it's been in the news a lot that higher income families especially have created their own learning pods for children. So we need to support families who don't have that privilege to do that with a voucher to help families support each other in their children's distance learning. We should allow families to hire a trust line background checked provider, and to partner with family child care's homes to provide the support that they may need, while caring for both a school-age child and non-school-age children. And so by having that trust-lined caregiver to be able to come in, then that provider wouldn't have to pay for that because she cannot afford that. And so we should definitely be supporting that with the voucher system.
Great. Thank you, Keisha. So we'll open it up now to any questions you may have. We'll have Sherry Zhang, our Research and Policy Associate, read out questions that have already been shared in the Q&A box. And if you think of any other questions, feel free to type those in now as well. So Sherry, do we have anything that's come in?
Yeah, we have a few questions. So the first question is, when asking about preferred type of childcare for school-age children, why was public K-12 not included as an option?
Yeah, I think, so public K-12, we don't consider part of the childcare system. So we were asking for people who needed childcare, what would their preferred childcare setting be, even if school was in session. So for a lot of them, it would be, before and after school care. But this was focused on like care outside of school.
Okay, the next question. The responses by income level are interesting. I've always wanted to know if money wasn't a barrier, if early ed was free, what would be parents' choices? FFN, family childcare, or center-based for each age group? Maybe for the next iteration of the survey. So this sounds like a suggestion rather than a question.
So yeah, so when we asked people what setting they'd be most comfortable with, we asked if you could have any type of care, what would you be most comfortable with? So I think that, it's possible that people were still thinking in constraints of what they could afford, but let me go down to that slide. You could still see differences with the income responses. So those with lower income they seemed to be much more comfortable with, here it is, with home-based care. Center was still top, but you can see family child care and FFN was a lot higher than the higher income group. And we also saw this with the people who filled the survey out in Spanish. They were much more comfortable with family, friend, and neighbor, and family child care, and center was third. So there does seem to be difference in preference that we captured here as well.
Next question. How were Chinese-speaking families able to complete the survey?
Yeah, so because this was a statewide survey, the number of responses generally that we would have been able to capture in Chinese is very small. So we always have the surveys in Spanish because it's a sizable population in California. This is similar to what the ECE workforce study decided to do as well. It's just when you're looking at it statewide, it's a small population that would respond in Chinese. If you're focused on certain areas or certain counties or certain regions, it makes sense to have that available. But we did, with one of our surveys, we also offered it in Chinese, and it was a very small response rate.
Okay, so the next question, This person would love to get a little more elaboration about the ratios recommendation. I think this is for the policy recommendation. How might that look or play out on the ground?
I'm going to kick it to Linda to speak more confidently. But first, I'd say, I think the point is to research and looking at how to not be hemmed in by the ratio requirement, but reconfigure classrooms so that it's more by family groups instead of age groups, if that makes sense.
That's exactly right what Keisha just said. I think it isn't a standardized way that we were thinking, but that one that should be looked at and to consider, given the health considerations now in terms of limiting exposure, and that's the number one concern on all our minds. And so just to figure out, is there a different way to look at that? Especially in family childcare or places where you might have mixed groups and are able to, to serve maybe more children, but a limited number of families. So that was what we were wanting them to look at.
Okay, thank you. So the next question. Person is struggling with getting good data on school-aged children. Given the large need for care and support for families with school-aged children, are you able to get good data on availability for school-aged children in your state?
So just to make sure I understand, they're asking if we're able to get data on the availability of childcare spaces for school-aged children right now. Maybe they can clarify.
Yeah, if the person that sent in this question could clarify in the chat or the Q&A.
We do, yeah, we do have access to data on, at least for centers, because the license is by age group. Although that would just be for licensed spaces. We can see what vacancies there are for school-age children, but that wouldn't necessarily include any license exempt programs. So maybe, yeah. Oh, and by the way, my email and Keisha's email are in the chat box. If you have any follow-up or other questions, feel free to email us. So maybe if that person wants to email me, I might be able to help them out more, or feel free to send in clarification.
And let me add a little bit more to that. I see the question is from Dion from Childcare of America. So just a little, is that some of the license exempt or school age providers are not, they're license exempt. They don't have a license, so they may not be tracked in our state system. But we also know, and we have data on school age programs that are funded by the state. So we have a state funded after school program, and there's also the 21st Century, and those are tracked, and we have those numbers. And I think as an earlier panelist or a questioner participant asked about that, is that yes, some of the after school age programs were operating on school sites, and those were closed during this pandemic. So, and that may not have been captured there, but the community after school options were included in people's preferences.
Okay, great. Thank you, Linda. Next question. What do you see as the top 2 or 3 priorities for the legislator to focus on next year? If you were to run a bill, which of these priorities would you choose to turn into legislation?
Thanks, Shannon, for the easy question. I think I'm sorry, I was reading the question to myself again. That was the awkward pause. I think that a lot of our recommendations would require a bill, but many wouldn't. But the ones that absolutely would have to do with the flexibility around in-home care, being able to provide care inside of the home. It may or may not require a bill. That may be a regulation. Or very smart thinkers figuring a way around the conundrum of minimum wage. But the issues around eliminating family fees, expanding 12-month eligibility. I don't have them all, I should know. Or can you go back to my slide? Under parent support. I'm sorry. Just so I can remind. And not that one. Yeah. Oh, right. Extending hours. So all of those things, I don't know actually which would require legislation or which could just be done if we just say, make it so. But those are the things that I would prioritize, is removing those barriers and especially financial barriers for parents, and making it so they can both afford care and providers still get paid for the actual care that they're providing. One recommendation that I believe we have well, I don't think we talked about but for providers is that the market rate is based on the market, and low-income providers are providing care to low-income families. Therefore, their market rates are depressed. And so we should also address that disparity and inequity, and shore up those payments and compensation to providers in low-income communities. So I would prioritize that, except I know that the landscape for legislation next year is unknown and hard, because there's going to be budget deficits. And I feel like a lot of us, we're just going to be fighting for just what we have now. But I think we need to think creatively and prioritize, know that we can't have a California economy if parents aren't able to work and childcare providers aren't able to provide care. And so that resources, even if they are new, should be put towards this effort.
I'd like to add a little to that. I would, to add on to what Keisha just said about having additional flexible dollars in this time. So just a reminder too, I think if people may or may not know about the R&Rs and the R&R network, that one of our important values are that we really hear from parents, and that's part of why we did this survey is to really hear from people that are most effective. And so hearing from parents' needs right now and this time of crisis was really important to us. And so I think the information is very instructive about helping direct where some of these needs could be met, and what the needs are. And so I think flexible funding, absolutely. And why I think that's also important about where we build next is, if you look at the slide on the income, if you look at the slide from the Spanish people that filled out the survey in Spanish, and if you look at those who do not currently have childcare, because if you remember what Gemma was saying, was those who had a previous childcare, they preferred what they had. So what's instructive is those who don't have childcare now, and in some ways you could say they're unbiased about where what childcare should be. So looking at their preferences, what they would do. So if you don't have childcare now, where would you want to go? And all those really speak to a lot about home-based providers. And again, not to say that centers are not needed and important, but I think it's something to think about where do you build next, especially in a rebuild economy where a lot of people have lost their jobs. It's hard to say what the demand or their needs will be. Will it be part-time? Will it be on and off? All those kinds of things. So I think the most flexible childcare arrangements to help them get or help them be able to work is really important. And knowing what that might look like is part of what we're looking at these both these recommendations and the data to help us.
Okay, great, thank you. We have a few more questions. So the next question is, can we get the data broken down by county or request data for our specific county?
Yeah, so if that is an R&R person asking, then definitely yes. The R&Rs were a huge part in collecting this data. Otherwise, send me an email and we can figure it out offline.
Okay, great. So next one is just a thought about centers. Some people may see them as institutional and not reflective of the family's values. Let's see. Oh, okay, so the next one, can you talk more about extending hours? What does that look like? What are the boundaries in terms of late evening care?
Extending hours is extending the hours that a family is eligible for care. So wait, can you read the question more? I'm sorry, I had I found it. Okay, what does it look like? What are your boundaries in terms of late evening care? The boundaries in finding non-traditional hours, the boundaries of non-traditional hours of care is finding a provider who provides it. That's the biggest hurdle. But also a family has a specific need in there if they're utilizing a voucher, let's say. And so sometimes that need doesn't cover the actual hours the actual amount of hours that they need care. And so we need to make sure that that's the case as well. So I think if I'm reading the question correctly, so the barrier isn't necessarily that a center or childcare isn't allowed to stay open. It's really in a family being able to access that care. I hope that's helpful, but write in again if it's not.
Okay, so next question. So you mentioned 422 respondents were disqualified. Can you mention some of the reasons why a respondent would be disqualified?
Yeah, good question. So there were people who responded that weren't in California, and this was really focused on California families. So that was about 22, I think, were disqualified for that reason. The rest were disqualified simply because they didn't have children 0 to 12.
Okay, thank you. Looks like those are all of the questions.
Great. Okay, well, yeah, if you haven't already downloaded the report, the link is in the chat box. Feel free to download there. If you think of any other questions that come up, feel free to email either me or Keisha. And thank you again for joining us today. We're really excited about this survey. We think it's a great step in trying to include the voices of the families that are affected by the pandemic in decision-making for the state. Have a good rest of your week, everyone.